Cancer. We know more of us are getting it, and more of us are living with the impact of cancer. With more people living for longer after a cancer diagnosis, the NHS needs to support them to live well, as for many, finishing initial cancer treatment is just the beginning. People who finished initial treatment often feel worried about how to tell if their cancer has come back and who they can turn to. That is why we need to listen to patients, understand their needs and give them the information they need to stay as well as they can be before, during and after their treatment. Macmillan believes people with cancer need high-quality information and support to help them to look after themselves and stay as well as possible for as long as possible. By sharing important information, we hope that patients will understand their cancer and feel confident in knowing what to do and whom to contact if problems occur. We know that for some people, modern-day cancer treatments will result in the cancer disappearing. However, for other patients, their treatment results in the cancer shrinking but not disappearing completely. Whichever group you fall into, this information may be useful for you. Over the next couple of minutes, we're going to provide information on one of the possible effects of cancer. We aim to help you understand what to look for and what action you need to take. Between 5 and 10% of people with cancer will go on to develop something called spinal cord compression as a result of their cancer. This is sometimes called metastatic spinal cord compression, or MSCC. For example, in a waiting room of 20 cancer patients, 1 to 2 could go on to develop spinal cord compression. You might be wondering, what is spinal cord compression? Spinal cord compression happens when cancer cells grow in or near to the spine and press on the spinal cord and nerves. The symptoms of spinal cord compression are caused by the increasing compression on the spinal cord and nerves. This pressure can happen at any level of the spine. Almost any type of cancer can spread to the bones of the spine, which may lead to spinal cord compression. It is more common in certain cancers, including breast, lung, prostate, and patients who have myeloma or lymphoma. This video clip is not intended to alarm you, but to help you recognise the important signs and symptoms to report early, so that tests and treatment may be done as soon as possible. It is very important to pick this up quickly, as treatment is more effective when started straight away. We will now go on to look at when you need to be aware, when you need to be alert, when you need to take action. Patients who do not have cancer in their bones or near the spine just need to be aware. The healthcare professionals looking after you will be able to offer you information and support to look after yourself and stay as well as possible for as long as possible. If your bones are affected by cancer, this often means your backbone or spine may also be affected. You may want to ask the healthcare professional caring for you about this. If your spine is affected by cancer, you need to be alert to the following symptoms. Back pain in one part of your spine that is severe, distressing or different from any usual pain you may have, especially if it affects the upper spine or neck. Severe increasing pain in the spine that changes with lying down or standing up, when lifting or straining, wakes you at night or prevents sleep. Pain which starts in the spine and goes around the front of the chest or abdomen. Pain down the leg or arm. A new feeling of clumsiness or weakness of the arms or legs or difficulty walking. Numbness in the arms or legs. Difficulty in controlling of passing water or opening your bowels. If you are experiencing any of these symptoms, take action urgently by contacting your healthcare professional team, key worker, or GP. It is important that you do this within 24 hours. The healthcare professional or GP needs to take action urgently. You need a full examination and assessment of your back and arms and legs, and you may need an urgent scan. This is outlined on the back of the spinal cord compression care and information card. The time between noticing symptoms and the serious consequences of spinal cord compression can be as short as days to weeks. If caught and recognised and reported early, the treatment options are usually surgery or radiotherapy. If action is taken immediately, there is an 80% chance of keeping the strength you have at the start of treating the spinal cord compression. We have explained when you need to be aware, when you need to be alert, when you need to take action. If you are unsure, please ask your healthcare professional or GP if appropriate, and they can give you information similar to the spinal cord compression card.